Non-alcoholic fatty liver disease, also known as hepatic steatosis, is a condition where there is an excessive accumulation of fat in the liver. Small amounts of fat in the liver are normal, but when this accumulation exceeds a certain limit, it can lead to health problems. There are two main types of fatty liver disease. 1. Non-alcoholic fatty liver disease, NAFLD. This type of fatty liver disease occurs in people who drink little or no alcohol. It is often associated with factors such as obesity, insulin resistance, a condition in which the body does not efficiently use insulin, type 2 diabetes, high cholesterol, and high blood pressure. NAFLD can progress to liver inflammation, non-alcoholic steatohepatitis, and eventually to cirrhosis, a serious condition that can lead to liver failure. 2. Alcoholic fatty liver disease. This type of fatty liver disease is caused by excessive alcohol consumption over time. Alcohol is toxic to liver cells and can lead to the accumulation of fat in the liver, inflammation, and liver damage. The symptoms of fatty liver disease can vary, and many people may not have initial symptoms. When symptoms are present, they may include fatigue, pain in the upper right abdomen, abdominal swelling, loss of appetite, unexplained weight loss, weakness, and mental confusion. The diagnosis of fatty liver disease usually involves blood tests to assess liver function, imaging tests such as ultrasound, computed tomography, or magnetic resonance imaging, and in some cases, a liver biopsy. The treatment of fatty liver disease usually involves lifestyle changes, such as gradual weight loss, if necessary, healthy eating, regular physical exercise, and avoiding excessive alcohol consumption. In more advanced cases, or when complications arise, specific medications or other treatments may be necessary to treat the underlying causes and reduce the risk of serious complications such as liver cirrhosis. Regular medical follow-up is essential to monitor the progression of the disease and adjust the treatment plan as needed. Among the most common early symptoms are persistent fatigue, abdominal discomfort, loss of appetite, abdominal swelling, and changes in the skin. These signs may indicate liver dysfunction and deserve medical attention for proper diagnosis and treatment. Let's explore each of these symptoms and their implications in the context of fatty liver disease. But first, I'd like to let you know that if you're looking for a personalized diet plan, I'll leave the link to Custom Keto Diet in the pinned comments. I'm sure it'll help you out. Now let's get started. 1. Fatigue. Fatigue related to fatty liver disease can manifest as persistent and debilitating tiredness that doesn't improve with adequate rest. It can be described as a sense of physical and mental exhaustion that interferes with daily activities and quality of life. Patients often report a constant lack of energy, even after prolonged periods of rest, and may feel drained by activities that would not normally be strenuous. This fatigue may be related to various factors associated with fatty liver disease. For example, fat accumulation in the liver can interfere with the organ's ability to perform its essential functions, such as processing nutrients, storing energy, and eliminating toxins from the body. Additionally, liver inflammation associated with fatty liver disease can trigger an immune response that consumes additional energy from the body, contributing to the feeling of fatigue. Fatigue can also be exacerbated by other symptoms related to fatty liver disease, such as sleep disturbances, abdominal pain, and general discomfort. Additionally, commonly associated comorbid conditions such as obesity, insulin resistance, and type 2 diabetes can contribute to chronic fatigue. It's important to emphasize that fatigue should not be ignored, as it can be an early warning symptom of underlying health problems, including fatty liver disease. A comprehensive medical evaluation is necessary to determine the underlying cause of fatigue and develop an appropriate treatment plan. 2. Abdominal discomfort. Abdominal discomfort associated with fatty liver disease usually manifests as a sensation of pressure, fullness, or pain in the upper right region of the abdomen, where the liver is located. Patients may describe a feeling of heaviness or bloating in this area, which can range from mild to moderate, but in some cases can be severe and debilitating. This abdominal pain or discomfort may be intermittent or constant and may be exacerbated by certain foods, physical activities, or body positions. For example, the consumption of fatty foods or overeating may increase abdominal discomfort in some people with fatty liver disease. Abdominal discomfort can be caused by various factors associated with fatty liver disease. Fat accumulation in the liver can stretch the hepatic capsule, the membrane that surrounds the liver, resulting in feelings of discomfort. Additionally, liver inflammation associated with fatty liver disease can cause irritation and sensitivity in the abdominal area. In some cases, abdominal discomfort may be related to more serious complications of fatty liver disease, such as acute liver inflammation, steatohepatitis, or the development of scars, fibrosis, or scar tissue, cirrhosis, in the liver. In these situations, abdominal discomfort may be accompanied by other symptoms such as jaundice, yellowing of the skin and eyes, abdominal swelling, and gastrointestinal bleeding. It's important that any persistent or severe abdominal discomfort be evaluated by a doctor to determine the underlying cause and ensure proper management. 3. Loss of appetite. Loss of appetite associated with fatty liver disease can manifest as a decrease in interest or desire for food, resulting in reduced caloric intake and unintentional weight loss. Patients may report persistent loss of appetite that does not improve over time and may be accompanied by an early sense of fullness after meals. This loss of appetite can be attributed to various factors associated with fatty liver disease. For example, fat accumulation in the liver can interfere with the organ's normal function, including bile production, which is essential for proper fat digestion. This can lead to digestive disorders such as nausea, abdominal discomfort, and loss of appetite. Additionally, liver inflammation associated with fatty liver disease can trigger a systemic inflammatory response that may suppress appetite. Pro-inflammatory cytokines released during inflammation can affect the appetite center in the brain, resulting in reduced hunger and increased satiety. Loss of appetite can also be influenced by psychosocial factors such as stress, anxiety, and depression, which are common in people with chronic health conditions, including fatty liver disease. These factors can negatively affect eating behavior and contribute to loss of appetite. It's important that persistent loss of appetite be evaluated by a doctor to determine the underlying cause and ensure that appropriate measures are taken to ensure adequate nutrition and prevent complications related to malnutrition. For abdominal swelling associated with fatty liver disease can manifest as a noticeable increase in the size or circumference of the abdomen due to the accumulation of fluid, ascites, or gas in the abdomen. Patients may report a feeling of fullness or discomfort due to abdominal distension, which may be more pronounced later in the day or after meals. This abdominal swelling can be caused by various factors associated with fatty liver disease. For example, fat accumulation in the liver can lead to increased production of inflammatory chemicals that affect the fluid balance in the body, resulting in fluid retention, edema, and ascites. Additionally, liver inflammation associated with fatty liver disease can interfere with the normal function of the liver, including the production of proteins that help regulate body fluids. In more advanced cases of fatty liver disease, abdominal swelling may be a sign of serious complications such as liver cirrhosis. Cirrhosis is a condition in which the liver develops permanent scars due to chronic injury, resulting in progressive liver dysfunction and impaired blood circulation in the liver. This can lead to fluid buildup in the abdomen, ascites, and other complications such as esophageal and hepatic varices. Abdominal swelling may also be associated with other symptoms of liver complications, such as jaundice, yellowing of the skin and eyes, gastrointestinal bleeding, mental confusion, and changes in kidney function. It's important that any persistent abdominal swelling be evaluated by a doctor to determine the underlying cause and ensure that appropriate measures are taken to prevent serious complications. 5. Skin changes. Skin changes associated with fatty liver disease can manifest as dark patches, rashes, itching, acne, and other dermatological disorders. These changes can occur in various areas of the body but are often observed in areas where the skin folds, such as the neck, armpits, groin, and elbows. Dark patches on the skin, known as acanthosis nigricans, are common in people with insulin resistance, a condition often associated with fatty liver disease. These patches can vary in color and texture and are usually more pronounced in people with darker skin. They are caused by the accumulation of keratin in the skin due to elevated levels of insulin in the blood. Additionally, fatty liver disease may be associated with skin disorders such as seborrheic dermatitis, eczema, and psoriasis, which can cause redness, scaling, and itching of the skin. These disorders can be exacerbated by systemic inflammation and hormonal imbalances associated with fatty liver disease. Acne is also common in people with fatty liver disease, especially in teenagers and young adults. The relationship between fatty liver disease and acne is not fully understood, but it may be related to hormonal imbalances, systemic inflammation, and increased sebum production by the sebaceous glands. Itching of the skin, known as pruritus, may also occur in people with fatty liver disease due to metabolic disturbances and accumulation of toxins in the body. Pruritus can be generalized or localized and can range from mild to severe, interfering with the patient's quality of life. It's important that any persistent skin changes be evaluated by a doctor to determine the underlying cause and ensure that appropriate measures are taken to treat symptoms and prevent additional complications. These skin changes can be an early warning sign of underlying liver problems, including fatty liver disease, and should be investigated and treated appropriately to prevent serious complications.